The big problems facing hospitals is so-called bed blockers, people who are ready to leave hospital but haven't got anywhere to go. For example, there may not be a suitable care home place. Well, last year the government allocated £500 million to help discharge patients more quickly. So is that helping in this region?
In the simplest terms, the NHS crisis can be attributed to a shortage of staff and a shortage of hospital beds. Last year, in an attempt to address the latter, the then Health Secretary Therese Coffey announced £500 million of funding to help get patients into more appropriate settings.
The local NHS will be working with councils with targeted plans on specific care packages to support people being either in their own home or in the wider community.
In fact, it's only recently any money's been paid out. Hertfordshire's in line to get around £9 million, split between the council and NHS commissioners.
Bang, I fell. And it was the coldest, one of the two coldest nights of that year.
Jean, who lives alone in Royston, spent 10 hours on the ground outside her house before being whisked to hospital. But she was keen to recover at home.
I had carers for 6 weeks, 4 times a day. Lovely people. I've had the help, I say, to put in rails on the stairs, cushions around the loo, special metal bars. There's no place like home. And that's the best way of getting better.
The discharge fund paid for wraparound support for Jean, including Meals on Wheels.
When someone is trying to become independent again, I think it is crucial that they can have support to get themselves built up. Jean had been in hospital for 10 days. That meant that she'd lost weight and actually she hadn't been moving around very much. So by coming in and making sure that we could give her really nutritious food, that helped her to become independent.
Doctors' leaders have suggested the discharge fund is a drop in the ocean, and it may be telling that Hertfordshire spent around a third of its money on bonuses for care workers. As for the rest,
we've invested in some care home beds, we've put some money into voluntary sector organisations, we've put some money into our adaptation service.
The money is welcome, but councils worry it's just a one-off.
One of the things I really call for in my work is some medium to long-term thinking, some medium to long-term planning that can help us create the services that we need, because it is a challenge. We really need that funding certainty to help us plan for the long term.
Earlier this month, the Health Secretary and Cambridgeshire MP Steve Barclay announced a further £200 million would be added to the discharge fund. In the absence of certainty, there is at least some urgency. John Ironmonger, BBC Look East.
Well, it may have been